please don't bring me orange sticky reptiles. It's really, there's no additional benefit. I've had some owners really go out of the way too. They're like, you know how hard it is to find carrot juice? And I was like, actually, I don't know how hard it is. And you don't need to do it. Like, you don't need to go to some specialty grocery store.
You're like, I'm gonna break your heart right now that you did all that work.
Yeah,
and good news, you didn't do anything harmful, but probably not beneficial either.
Yeah, you probably ran around for 3 hours to 4 different grocery stores to find carrot juice when you could have turned on your tap water.
Hello, everyone. So glad you're back for today's show. I am thrilled to be joined once again by the amazing Dr. Dana Varble. And for this episode, we decided to continue our conversation on reptile medicine. I am loving these talks that we're doing about reptiles. Every time we have these conversations, we find some new topic to cover in our next conversation. I'm learning a lot. I hope you are too. It's fascinating. So for me, as someone who admittedly has minimal experience with reptiles, but who also thinks they are so interesting, I love hearing about some of the different issues that come up with reptile husbandry and reptile medicine. And while of course there's a lot of nuance when it comes to reptile medicine, there's also a lot of similarities to large and small animal medicine. And I think that's something I hear echoed just across the zoo medicine field. I know Dr. Proenza, who I've had on the podcast before, really makes this point regularly, that just the same way we would think about working up a dog or a cat or a horse or a goat in terms of what are the most common differentials for this type of condition? Are there breed-specific influences we need to be aware of? In order to work through the differentials and get to a definitive diagnosis, what sort of tests do we need to run? Do we need blood work? Do we need x-rays, ultrasound? And applying that same systematic thinking into our exotics as we would in large or small animal practice. In this specific episode, we dove into some common myths that pet owners may encounter with respect to reptiles and really a lot of reptile husbandry issues. There were some funny ones, some that kind of made us grit our teeth and say, oh, please don't do that. But ultimately, it came back to the same message that even when we're dealing with pet owners who may have made a misstep based on inaccurate information from Dr. Google or other reptile owners or whatever source they may have encountered, these are owners who are generally trying to do the best for their animals, and it's our job as veterinary professionals to offer guidance in a lot of the same ways we would with some of the off-the-wall things we might hear when it comes to dog and cat medicine. So although she needs no introduction, let me go ahead and tell you about Chief Veterinary Officer at NAVC, Dr. Dana Varble, and we will get into our talk about some of the common myths surrounding reptile medicine and husbandry. Dr. Dana Varble received her veterinary degree from the University of Illinois in 2003 and earned her Certified Association Executive designation from ASAE in 2021. She's practiced clinical medicine in exotic pet, small animal general practice, and emergency medicine, and serves as an associate veterinarian for Chicago Exotics Animal Hospital. She's spoken locally, nationally, and internationally on herpetological and exotic animal medicine and the state of the veterinary profession. She joined the Association of Reptile and Amphibian Veterinarians in 2003, served on the board of directors from 2008 to 2014, and was president of ARAV from 2012 to 2013. She continues to serve as the managing editor of the Journal of Herpetological Medicine and Surgery for ARAV. She's also a member of the American Veterinary Medical Association and the Association of Exotic Mammal Veterinarians. In 2015, she joined the NAVC, and in January of 2020, she was named as Chief Veterinary Officer. As an NAVC spokesperson and veterinary industry expert, she promotes animal health and the veterinary profession through media interviews and appearances, including CNN, Steve Dale's Pet World, Pet Life Radio, NBC News, and local media outlets and others. All right, let's go ahead and talk about reptiles.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serolaner Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serolaner belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicaTrioDVM.com for full prescribing information.
We're back again with Dr. Dana Varble, and I've been looking forward to this episode ever since our last episode talking reptile medicine, because that one I learned a whole lot from our talk. And then this one, we're going to debunk some myths. So I'm like very excited about what the myths are and then the debunking process. So Dana, thanks for joining me. I always love having you on the podcast.
Cassie, it's great to be back. It's always fun to chat reptiles. Everyone knows they're my favorite. And I think we're gonna have fun today because some of these myths are pretty wacky. So
They are. They are. And I'm like dying to know. I wonder if we can find like the origin story of some of these. You may know the origin story for some of these, but I'm like, where, same thing in dog and cat medicine. It's like, where did we come up with this?
Yeah, yes. Where? Why?
Why?
Why would you think that was a thing? That's not a thing. It's very strange stuff. Very, very strange stuff. But
We say with love. Yes.
we do. Yeah. It's always interesting. So
Yeah, it could because truly, in fairness, we're going to get into some of these myths. And of course, if we're talking about pet owners and things who are subscribing to some of these myths, if that's the case, we know that this is coming from a place of like wanting to do the best thing for your pet. No one is, doing something that is either ineffective or potentially harmful with any negative intent. It's always with positive intent. But maybe we can kind of put some science behind some of these and find some more effective ways to manage reptiles or stop behaviors that are potentially harmful.
yeah, I mean, I think that's a really important point to keep in mind. The idea that I know we get really frustrated with owners when they're just like, Dr. Google said, and Dr. Google or my breeder or the pet store. But I think the perspective to keep in mind is the one you mentioned. Like they're trying. They want something, they want an answer, they want to do better. So gentle redirection.
I think that's the name of the game.
Yeah, gentle redirection and maybe just even taking the time to acknowledge, like, I know you want answers. I know you want to fix this. I know you want a solution. I know you want to make your pet better. So let's find, let's get you back on track. Let's get you with some things that are actually going to work and not doing some of these really interesting internet-based choices that you found for no reason whatsoever.
I'm really curious. This is not one I've ever heard of before. About soaking reptiles in carrot juice. Like I'm just picturing like a bright orange, like crested gecko running around soaked in carrot juice.
You're not wrong. You are not wrong. Yes. So carrot juice is full of beta carotene. I think some people just think, oh, it's so rich in vitamins that there's a lot of myths going around about reptiles needing additional vitamin A, additional, these extra things when they're ill, which can be based in science. Some animals do get vitamin A, get hypovitaminosis A. You do need things like B vitamins to get better. So somehow the jump occurred, like we need vitamins to get better, we need fluid to get better. I'm not sure where it happened, but then we made the jump to carrot juice. So then
specifically carrot juice. Like we're not soaking them in Gatorade. We're soaking them in carrot juice.
Carrot juice. And I go back to like, I think it's the beta carotene vitamin A thing, but that's where I think it came from. That's just a theory. Again, hopefully there's some good internet sleuths listening who can like maybe find out where this came from. But these poor creatures come in and you're right, they're orange. I mean, they're literally orange because people are like, well, I heard it made them better. So I started doing it. And, I mean, the good news is, other than the fact that they are orange and sometimes a little sticky, um, it didn't hurt them. It probably didn't help very much either, but it didn't hurt them. We have this idea with reptiles that, and again, this is almost an internet myth inside an internet myth because there's some truth to it, but caveat. So, long story short, we've always talked about soaking reptiles to increase their hydration, to help with hydration when they're sick. And then this idea came up that they absorb fluids through their cloaca, through their large intestine. And the problem is that there are thousands of species of reptiles, and what's true, what may be true in some species isn't true in others. But we often just put them in this big bulk category that says, hey, soaking them, they're gonna take up fluid through their vent and it's gonna make them better. Soaking is not a bad idea in and of itself. How much fluid they actually absorb versus just a general increase in humidity, or sometimes animals will drink when they're being soaked, which can be a really good thing. Again, increasing fluid intake when people are ill is a good thing. But I'm here to tell you water works just fine. Um, Water's a great, again, you don't need to add electrolytes to it. You don't need to add vitamins to it. Please don't bring me your orange sticky reptiles. It's really, there's no additional benefit. I've had some owners really go out of the way too. They're like, you know how hard it is to find carrot juice? And I was like, actually, I don't. I don't know how hard it is. And don't, you don't need to do it. Like, you don't need to go to some specialty grocery
Oh,
store.
you're like, I'm gonna break your heart right now that you did all
Yeah.
that work.
Yeah.
And good
Like,
news, you didn't do anything harmful, but probably not beneficial either.
yeah, you probably ran around for 3 hours to four different grocery stores to find carrot juice when you could have turned on your tap water. Uh,
Oh my
so,
goodness. And
yeah.
yeah, and it's one of those where like the jump makes sense. Okay, if they're
Hmm.
absorbing fluids when we soak them and we're talking about hypovitaminosis A, like the logic is there, just the actual it doesn't actually
The
deliver
mech,
on the promise. Yeah, the mechanism.
yeah, the mechanism is missing. Love the intent, love the plan. Let's adjust a little bit.
So let's talk about, like you said, you could just turn on your tap water. Because I want to talk water for a second. When we talk about a lot of our reptiles that people keep as pets, they're desert reptiles. You think about
Mm-hmm.
bearded dragons and such. So one of the myths that we kind of found as we were developing this podcast is desert reptiles don't need water. And I mean that actually seemed like that could be a really harmful one. That one's a little scary, like just to read that myth. I hope that we're not, depriving these reptiles of water on a broad scale basis.
I don't think it's broad. That's the good news. I
Good.
don't think like there's a lot of owners, but it is really difficult because, some reptiles really don't spend a lot of time like drinking water like you would expect from a dog or cat. And even if you think about it, there's a lot of like, how much do cats drink, right? Like they're not out there like gulping down water like a dog, being really goofy about it. So,
Right. It's like a constant battle with cats of like, how do we get the cat to
absolutely.
drink the water?
It's exactly the same. So think about, these reptiles like leopard geckos, like your sulcata tortoises and your desert tortoises, and even like the Greek tortoises, bearded dragons. They do live primarily in desert environments. And, is there a lot of behavioral drinking in their repertoire? Do they walk up to a pond a lot and drink a bunch of water? Well, the answer is probably not. But also, within that big, broad desert environment that they live in, there are microclimates. And those microclimates include little holes with puddles and high humidity environments. So I think this arose because, again, a lot of times with bearded dragons, with your leopard geckos, with your ball pythons, you don't see a lot of drinking behavior. So you just think, well, why am I going to put a bowl of water in with these animals? I'll just, we'll just miss them occasionally and we'll be good to go. The problem is that occasional misting doesn't create the humidity that actually is present in their natural environment, in those little microclimates, in those holes that they live in the underground environment. So it's really important that every animal, regardless of their natural environment, have a bowl of water that can either they can drink from, they can soak in, or even more importantly, with some of these desert reptiles, just as a constant source of increasing humidity in their environment. Because what we find is, and it's actually kind of a fun little home experiment that you can do safely, is if you ever have a tank with, and it could be empty, or you could even do this with your reptile, again, as long as it's very limited. If you take the bowl of water away and you get a hygrometer, the little basically thermometer humidity combo readers. If you take the bowl of water away and check an hour later at the humidity, you're going to find that it's significantly lower because in their little warm environment where you've got their heat pads on and you've got their UV light going, you've got their heat light going, that water is constantly evaporating, and it's evaporating in an environment, again, like a tank, like a bin, where it's recirculating. It's actually more humid inside that environment than it is just outside their environment in your house. So that bowl of water, yeah, they may not go up to it and drink, but that doesn't mean they don't need it. So even if you don't see animals drinking, they need a bowl of water. I promise.
Yes. Obviously, I'm not a reptile, but I live in Florida where the air is water. And
Yes.
it's October and it is 90 degrees. And I will tell you, like, absolutely need to drink water. And
Mm-hmm.
that certainly, like as soon as you said putting the bowl in there, just having it in there, my mind immediately went to humidity because, of course, like we
Yeah.
experience that all the time, especially here in Florida. I also Googled it while you were talking, and just for reference, you can get a hygrometer on Amazon for like 10, $15.
Not
So
expensive.
yes,
Yeah.
easy experiment to do to kind of
Mm-hmm.
really like keep an eye on the humidity for these guys.
And what we're finding in reptile medicine is that as we've gotten a lot better, like we're taking better care of our reptiles, they're living to be seniors. Unfortunately, a lot of animals that require humidity, especially like very sensitive reptiles, so like green iguanas come to mind. A lot of them, when they get older, water dragons are another one just popped in my head. Even crested geckos. These animals are probably more sensitive to humidity than we realize because we're seeing a lot of kidney disease in them as they become seniors. And this is just a theory. I put it above internet myth, but the chances are that these animals probably need to be in more humid environments than we're providing them. So hopefully we'll see some research out on this. But yes, humidity, even for a desert reptile, is a good thing.
They're like they have more in common with cats than we ever gave them credit for.
Exactly. They're just
But
little
that
weird gnats. Yeah.
yeah, exactly. Like little weird, they're like ferrets. No, I'm just kidding.
Mm-hmm.
Now I'm going off on a in a whole different direction. One of the things that comes to mind is something from our last talk where, we talked about the tools that we have to take care of these animals are becoming much more readily accessible and easier to use. They're just kind of more common sense around them. So absolutely, like we're seeing them live to be more senior
Mm-hmm.
and now fortunately, as we're seeing kidney disease and things like that, we have more and more tools to help manage that. And hopefully, like you said, as we're learning more as time goes on, maybe help prevent it. Okay, all right, bouncing around a little bit here. I want to jump back to the carrot juice and, along the lines of these like quote unquote like natural treatments and
Mm-hmm.
talk about oregano. And we have some spicy reptiles.
So this is my favorite because it's actually spawned a whole like research project for multiple reptile vets over the years. And somewhere out in the world of the internet, the idea came out that oregano was a good parasite treatment, specifically for coccidia, I believe.
Oh, if
Um,
only.
I wouldn't that be nice? Wouldn't that? I mean, I really like no one doesn't wish this was true. Like,
Right.
if it was as simple, like if we could treat dogs and cats and reptiles and bunnies and everything that gets coccidia with, and could you imagine?
Oh, it'd be amazing. Yeah, we just like all
We'll
of
just
dog food,
sprinkle
reptile.
some
Yeah, it would all
oregano
smell like Italian
over
food.
it. Yeah. I mean, oregano's an herb. It's not one that it doesn't have like a real toxicity profile. Like everything can eat oregano, right? So, like, how brilliant would it be? I mean, there are poultry vets hopefully listening to this going, "Oh my God, I wish that was true." Because poultry, there's like coccidia are a very big deal. So, wouldn't it be brilliant if we could treat coccidia or parasites in general with something as simple as oregano? But this arose, we do see coccidia in reptiles, specifically in bearded dragons. In bearded dragons, we do actually see pathology associated with coccidia at times, specifically liver and kidney and GI pathology. So this arose, as bearded dragons became more popular pets, someone said, well, we can just deworm them with oregano. And we were like, what? What? I'm sorry, you're using what as a dewormer?
This
And
whole
they were like,
time, like
yeah,
it's been
oregano.
right under our nose, literally.
So I know, were that only true? So we made, some people did some really great research on this. Oregano does not work as a parasite treatment in many, for any parasites that we have found so far. They've done some great double-blinded studies where they've had animals that were infected, naturally infected with specifically coccidia, treated them with oregano, treated them with a commercial pharmaceutical prepared anticoccidial treatment. I believe it was a sulfa drug, very common treatment for coccidia. And yet the oregano, no surprise, does not work. So it just,
Aw,
yeah,
so disappointed.
I know it was actually, and again, it's one of those things you were like, I want, like, you kind of like, it's crazy because you're like, you did a whole research experiment on this. But I think it was really important to investigate and debunk because, yeah, we one, if it worked, that would have been great. But like, there's really no medicinal qualities to oregano that we're aware of. It's not going to work, guys. It's a little bit like saying, I'm just going to eat romaine lettuce and my influenza is going to go away. Like, I wish that
Right.
was the case. Like, wouldn't that be great? But yeah, oregano is fun, but no need to give it to your reptiles. No need.
Not going to treat coccidia. Yeah, and it is important, like you said, because then
Hmm.
when, and to do that formal project, because then when you have owners, who are wanting to treat this way, there's some data to back it up to say that's not going to work. And hopefully having that conversation will go a long way into preventing some of the pathology you see related to coccidia in these reptiles.
Yeah, and it's sometimes silly to think that we have to disprove these things, but to go back to our optimism thing, like, wouldn't it be great if it did work?
Right.
Like,
I was
oh
gonna say,
my
I think we
gosh.
had to disprove it to ourselves and say, like, what if there is truth to this and we have this whole other treatment option that's safe and effective and readily available. So yeah, I think probably the optimism played in quite a bit as well.
Fingers crossed. Didn't work. Oh well, back to square A. But again, we have a lot of other good options, so that's the important thing here.
Yes, yes, absolutely. Let's talk about social media myths.
Oh, these are like some of these are so cringy.
I know, I know. We
Oh,
looked at some videos when we were putting these myths together, and we have to talk about manually expressing pores on
oh,
reptiles. Like watching these videos, it like I saw a Chinese crested and like the temptation to just go after every single blackhead on these little guys, and fighting the urge to do that because inevitably they'll get infected. And I'm assuming probably something similar in reptiles.
yes. So, for those of you that are familiar, obviously on the ventral side, specifically of most lizards, not all lizards, but a lot of our pet lizards have on their ventral aspect femoral pores. And these pores essentially are very similar to scent glands. There's skin produced in them and odor. They're more prominent in males, typically, again, species dependency there. But, for our common pets, our green iguanas, our bearded dragons, some of our geckos, these pores are really prominent and they get kind of really full of this thickened, again, sebaceous-y kind of, and it's skin cells, it's keratin. And that material is like kind of gradually lost over time. typically in very mature males, they'll be pretty big. They're pretty prominent. So you see these videos of people squeezing all of the keratin material out of the pore. And if you're into pimple popper videos, okay, I get it. It looks amazing, right? Like satisfying, this big plug of keratin, icky, yellow to like clear material comes out, and you're like, oh my God, look at that. It's totally empty. That must be healthier, right? It's not. That material is supposed to be there. It's supposed to be there. Those pores are specifically made to have that keratin material in them, to have that plug in them, for that plug to stay about the same size. And again, some of them are very prominent, but when you're like pushing on them, you can imagine like that's not something that's supposed to happen. So they're not supposed to be open and exposed to the world, and especially on the ventral side of a lizard. If anyone's ever picked up a lizard, you know what else is on the ventral side of a lizard? Their
Hmm.
vent and usually fecal material. So those pores are not supposed to be exposed to that fecal material. They're not supposed to be open to the environment. So when I see people that have been doing this, it's you have to like approach this with caution because they really think they're helping their animal. They're like, oh my God, look at I'm so good at expressing these pores. And you're like, yeah, now they're all infected. And
Oh,
it's
is there
lame.
ever like a scenario? Do they ever get like clogged or something like that where like it would be indicated to express them?
So usually when that's the case, it's first of all, let's throw this out there. It's extremely rare. It just like when reptiles get infections, and we've talked about this on other podcasts, they don't get purulent material that comes out of their infection. It's not pus, it's not liquid, it's caseated material. So it is very thick, very heavy material that you need to, debride or remove from a wound. So when I see femoral pores that are infected, it is actually more important to sometimes they actually have to be like surgically removed
Oh, wow.
because yeah, it's just like any other abscess on a reptile, debridement or surgical removal can be really important because it's really hard to get antibiotics through that material and into the source of infection. So, for owners out there, this is a medical this is like, I need to go to the doctor. This is a medical concern. But to be honest, if we're not messing with them, femoral pores are infections, femoral pore clogging is incredibly rare. It's incredibly, incredibly rare. So I would say most of the time, don't mess with them. I've had to surgically remove one like set of three or four on a green iguana that were just infected really abnormal. And we're not sure why, but they were very abnormal once in my career. So super rare. Don't mess with them. Leave them alone. They're doing their thing. They're just fine on their own.
Sure. And when you say remove them, you removed the pores themselves or the material in the pores?
Good question. I did a whole surgery to end block remove the pore and the skin around them because,
Okay.
yeah, it's not a bad surgery, but like you don't want it. You don't want to see that.
No, all the more
You don't
reason
want to
not
do it.
to
Yeah. So
express them. Like this one
don't
really
touch
could be
them.
harmful. Like this could land
Yeah.
your reptile having to have surgery.
Yeah. Usually usually I just kind of again, gently guide them to, oh, actually that material's normal. And let me show you what they normally look like. And hopefully, we talk about like they're not meant to be open to the environment. That material that's in there is actually protective. These aren't really pimples or blackheads like you see on with acne and acne like conditions. So just let them be. It's actually that stuff in there has a job. Strange enough, but it has a little bit of a job. So,
They've lived for
yeah,
thousands of years with these. They're okay.
they are not a primary medical problem. Let's not make them one, please. Yeah.
Oh, goodness. And kind of along those same lines, let's talk
Hmm.
about shedding. Because
Yeah.
this is like I've seen, these types of incidents and videos and things like that before. And I mean, yeah, this doesn't seem like something, again, reptiles have been doing this for thousands of years. So maybe we just let them do it on their own.
So, look. I get it.
It
I will
is
throw it out there.
satisfying, right?
It is satisfying. Like, so obviously most reptiles shed, I mean, snakes are the best example because like they shed their whole skin at once. A lot of lizards go through shedding cycles where they shed a majority of their skin at once. If you can find like one of the crested geckos or one of the Leachianus geckos, videos of them shedding their skin on the internet, incredibly satisfying. Incredibly satisfying. I don't know what it is about us, but like as humans, it fulfills that need to like groom things that we love and it looks amazing, right? Because the skin comes off in like one beautiful chunk piece and again, it's so satisfying. But most of the time, reptiles don't need help shedding. And you see some of these videos where people are like picking at their snakes or their lizards and if you know anything about animal behavior, you're instantly like, that is like that reptile does not want you doing that. Like they're pulling away. They're running to the other side of their cage. Politely get a clue. They're not right now. Like,
All due respect, like they're
yeah,
running
like
away.
they're running away from you. Like if that was your dog, you'd understand that like this isn't okay, this isn't pleasant. And again, most of the time they don't need it. Now we do see what we call dysectasis, which is a shedding disorder in reptiles. And to go back, this usually goes back to like the humidity in their cage isn't proper. They're not able to shed that skin because of humidity. So if you're truly seeing that, the first thing is to go back to again, full circle. Let's do a soaking. Do, just a small amount of water. Tap water is fine. Lukewarm tap water, room temperature tap water is
Not carrot
fine.
juice.
Not carrot juice, not pineapple juice, no juice, no juice. No electrolytes. You don't need to do Pedialyte. That's another one I've seen. Don't soak them in Pedialyte. Just, water can help with humidity and promote good shedding. But there's honestly, if they're especially lizards, I find because they don't shed in one continuous piece, like most snakes, they shed like kind of chunks at a time. So people are very tempted to like help them by peeling it off. You don't need to. They're going to take care of it. If they're not taking care of it, again, try soaking, try humidity. And then if it's really persistent or something's happening, you will see like this, what we call retained eye caps in snakes, where the scale specifically covering their eye, covering the speculum of the eye, gets retained and looks really cloudy. The sensitive area. Like
Sure.
eye medicine is sensitive. Eye medicine. Ophthalmology is ophthalmology. You don't poke things into your own eye, don't poke things into your sides, just usually that's going to require again some help from a veterinarian, some increased humidity, something else. But no need to help your reptiles shed. They got it. Like you said, thousands of years. No
Okay,
worries.
and I'm glad that you brought up the spectacles because that was going to be my question, as I know that's an area where snakes specifically can have
Hmm.
trouble. And I think that's good advice. Like if you wouldn't, pick things off of your own eyes, let's not pick things off of their eyes. That seems dangerous and painful. And then you would have to see an ophthalmology issue, which I know would not make you happy in your
It would
day.
not, yeah, I was gonna say, and if, here we're gonna go back to like if any of you have ever listened to our podcast before, like ophthalmology is not my jam. Um, and by not my jam, I mean I'm horrified by it, and I have like the utmost respect for ophthalmologists of any type, human, veterinary, whatever you work on, you're amazing because you work on a part of the body that I am so freaked out by. So good for you. Thank you so much for doing it. Don't poke things in eyes. That's my message.
And we will all have a better day. The snake will have a better day. You will have a better day. Dana
So
will
much
have a better
better.
day.
So much better. Yes.
Oh my goodness. Well, so and talking about this, the pores and spectacles, things like this, we're talking about medical procedures, surgical procedures in some
Hmm.
cases to treat these. So let's talk medical myths for
Mm.
a second. These actually were kind of surprising to me. Something like anesthesia is too risky and these patients die. In our last podcast, we talked pretty extensively about reptile euthanasia and how complicated it is. And how difficult it can be to even be sure that you successfully have euthanized a reptile. So the idea that they're going to die under anesthesia was kind of a surprising one to me to see that.
It does seem like it floats around. Now, I will say this, like, it's really interesting because, like, it's very hard. If you've ever tried to sedate a reptile, super slow metabolism, it can be frustrating. So, it's interesting because we're so used to mammals with their faster metabolism. We give them drugs, they work. We reverse the drugs, they get, they wake up. Reptiles, I think one of the frustrating things for us as veterinarians is they can be hard to sedate because their metabolism is really slow. And then it feels like there's this tiny little window, right, between like sedate enough for anesthesia, but not so sedate, we're going to kill them. But I promise you, it's wider than you think. Like you do have to use a combination. Like anesthesia in reptiles is very different than mammals. Again, super slow metabolism, different drugs. Usually, it really helps us hone in. Like we really have to become good anesthesiologists if we're going to work on reptiles because they're great examples of like they love a drug combo. Like, don't just give them one thing. Like, if you're just giving them diazepam or midazolam, you're just gonna get a slower reptile. Like, that's great. Can help with many things, but you're not going to get to the point where you can intubate and do, surgical things on them or do big procedures. But that's not to say that if you get them to the point where they're under anesthesia, like all hope is lost, they're going to die. So, you know, it does take a little bit more nuance to do anesthesia on reptiles, but you can do it. You can do it. I promise you. Drug combinations are a wonderful thing. Take advantage of all of the different, you know, mechanisms of action for anesthetic drugs. Use different combinations. There's some great ones out there in publication. Long story short, this isn't an anesthesia podcast. That's like a whole different podcast and maybe like a whole different PhD, let's be honest.
For
But like,
reptile anesthesia.
yeah, but like I mean, we have amazing drug. Like, I will just say that if you haven't used alfaxalone, it doesn't work for like the big tortoises, really big reptiles, but most of our pets are not, 70, 80-pound reptiles. Most of them are small. Alfaxalone, there's some great protocols out there with it. It's a really reliable anesthetic and sedation drug now for reptiles. Love it, live it, you use it all the time. It's
But not by
fantastic.
itself.
Often not by itself. Yeah, you're probably gonna have to get, but again, it depends on what you're doing. Like,
Sure.
are you just doing a quick set of x-rays? Are you doing a little CT? Are you doing a little toe amputation? You can combine it with some local anesthetic or a little tail amputation or, skin biopsy. It might be enough. Again, combined with some local, it can be a really satisfying thing. And I think it's really helped the approval and the availability of alfaxalone has really helped us. But don't discount your other drugs, your dextromethorphan, your ketamines, you know, your opioids can be great drugs for reptiles. So just break out the book and break out your fun combinations. So again, going back to like now it feels like they're similar to cats again. Going
I
back to
mean, but
those.
cats do love some Alfax.
They do, and they love a drug combination,
They
right?
do.
Like you don't want to just give cats midazolam. You're gonna have like a
Oh no.
tired cat that's clinging to the
No, you will
ceiling,
have a cat on
right?
the ceiling with just midazolam.
Who's
Like they will climb your face all the way to the ceiling when they get that paradoxical excitement.
exactly who's having like a great day on it, but like not great to work on.
And they're
So
yelling, and
yeah,
reptiles probably don't do that part. But yeah, the excited
typically
cats are
no.
very
Yeah.
vocal.
Exactly. Depends. There's some more vocal reptiles out there, not the common ones though. So that's the good news. Yeah.
Oh
So,
my goodness. Well, and I love that you brought up the combinations and using the
mhm.
opioids and things like that. You talked about toe amputation, tail amputation, because of course we want to have good pain management if we're
Yeah.
doing these types of procedures. Another myth that came up is they don't feel pain. And again, shocking to see this because we used to think this about all animals, which
Yeah.
still blows my mind. Especially, just of course seeing the things that we see in practice. But Yeah, in my head, I'm going, why would they be any different from, say our dog and cat patients or our horses, cows, whatever it may be? Of course, they would have nociceptors. Is that
Well,
the right word? Did I?
nociception,
Nocis,
yeah. I mean,
yeah.
so it's really interesting because there's a lot of, there's again, it kind of comes from a couple things, the idea of like, oh, reptile brains are relatively primitive, which they are. No, no argument there. They are, they don't have like a developed like cerebral cortex area in their brain. So the it's sort of interesting. We're really starting to just scratch the surface of how reptiles we can use. I shouldn't say we're just scratching the surface, but the idea of operant training in reptiles and what parts of their brain they use is still relatively young. There's some fantastic captivity work that's being done specifically with crocodiles because crocodilians, alligators, the caiman. I mean, these are huge animals. We want to be able to work on them easily, so we have to be able to train them, and they've been able to do that. And I think along with this idea of like better science surrounding their neurologic systems and what they're capable of, we've moved away from the idea. And I think it was always like, oh, they just experienced nociception. So nociception is like the idea of a noxious stimulus resulting in a reaction. And this is nociception is very primitive. It's the idea that, you're going to move away from things that harm you versus the idea of pain. And pain involves quote unquote higher brain functions. The
Right, because
idea
it's the
of,
emotional response
yeah,
to
the
the
idea of
nociception.
discomfort of, is it associated with fear, stress, anxiety, things like that. And so for a long time, there was this idea that, well, reptiles feel nociception, but they don't feel pain. I, and again, this is an area where we still need research. We still actually need work to be done in this because it's really unclear how we measure pain and how we use analgesics in reptiles. And if you read some of the studies, they're really interesting if you're into that kind of thing. Because for a lot of pain studies, and Cassie, you've probably seen these where they'll use like an infrared heat gun, or
Right.
they'll use something to say, oh, when withdrawal slows down, we know analgesics are working. Specifically with snakes, although even it's to some degree lizards, turtles, tortoises, it's really hard to get the same reaction from the same stimulus. So for example, we know that reptiles will sit on a heat rock and get a thermal burn from it. It must
Huh.
hurt. We know it hurts, right?
Right.
So why, but then we use, again, these infrared thermal guns to measure analgesic response. And people who've done this research, the scientists, the veterinarians that are doing this research, admit that there's like a disconnect there. Why? Is thermal nociception, is thermal pain perceived differently in reptiles versus a crushing pain versus a cutting pain versus something else? So, there's work to be done here because we don't always get the kind of responses that we think we should. We know certain analgesics work in reptiles. There's been some great work done out there on specifically the mu agonist opioids, the hydromorphones, the morphine, fentanyl. And we also know that things that are like partials, like buprenorphine and butorphanol, may not work at all. But there's also this huge body of research on how do we even elicit the right response to measure
Right.
pain. So again, lots of work still to be done, but based on this work, we are more and more confident that they're feeling pain, that it's associated with fear, stress, and anxiety, and that we need to treat it. Because just like any other animal, that probably elicits a stress response, cortisol, slows healing, all those things. So, lots of work still be done there. The good news is that there's some early work done. Like I said, we definitely know some drugs seem to work. NSAIDs are another area where we're seeing a lot of research being done. We know they get into circulation. They know they reach levels that are therapeutic in other animals in there. So, for example, I believe a lot of this work's been done with meloxicam. We know we can give it orally, that it gets into their bloodstream, that it reaches therapeutic levels, but those therapeutic levels are based on typically the cat, dog, large animal therapeutic levels. It's hard to do this with reptiles, right? When dogs and cats are two species. When we start talking about reptile pets, bearded dragons are not leopard geckos, which are not red-eared sliders, which are not ball pythons, which are not corn snakes. So
So much
when
work to be done here. Like there's so many
making some
questions
leaps,
to
right?
answer. Yeah, I mean,
Yeah.
you would think with like these studies that show that the full muse are working, of course says, well, then there must be a pain response. But I think you made a really good point about, pain being different from nociception and
Mm-hmm.
with the differences amongst all the different species and subspecies of reptiles and the inability to get a response in some of these critters. Yeah, there's a lot of questions to
Mm-hmm.
answer here.
Mm-hmm. There are, and it's a fascinating area of research. Again, it's hard to like cover this quickly because like again, it's a whole PhD. It's multiple
Yeah,
PhDs have been done on this, and multiple PhDs still need to be done. So, it's just one of those things. Don't think they don't feel pain. Pull out those drug formularies. Find something in your clinic that works. You can do it. And I think from a welfare perspective, there's a lot of push to let's assume that they're feeling pain, that it's to some degree
hmm
associated with the emotional, active conscious response of fear, stress, and anxiety. Let's treat it because one, it's good medicine. Two, it's good welfare. Three, we know there are things we can do safely. So, in the effort to provide the best care, do the least harm, this is the right thing to do. But yeah,
Absolutely. Absolutely. We do the best with what we have right now.
hmm exactly. And we hope and we support future research.
Yes. Yeah, absolutely. Absolutely. Well, gosh, I still have more here and I wanna keep delving into them, but I know we're starting to run short on time. I'm like, it's taking everything in me not to be like, what about this one? What about this one? So I will just, throw out a blanket question here of
Sure.
Dana, this has been amazing. As always,
Thank you.
I learned so much when we talk reptiles, and I can't wait to talk reptiles more. I hope we can keep having these conversations. What final thoughts do you want to share?
I think for pet owners, the news here is like, you know, and for veterinarians, I think it's all wrapped up. Good medical care is the same for everyone. Like good medical care for your dog means going to the vet once a year, asking your veterinarian, asking their office, asking their technicians for advice, care advice, things you can do at home that are based in science that will get you the most effect for your effort. Like there's no need to go buy carrot juice, just do the soaking. Let's use your time, your finances, your efforts to do the best things for your animals. And the same things for us as veterinarians. Like if good medicine is doing blood work on a dog that's sick, let's do blood work on this reptile too. Let's do the things that we would normally do that are part of good medicine, do an assessment, do a risk analysis or, risk benefit kind of analysis, and let's make good decisions. And we can really, again, I love reptiles as pets. I love them as patients. I think there's just so much that can be done with them. Possibilities are endless.
Absolutely, absolutely. And you made a really good point there about, if you would do it for your dog or your cat,
Hmm.
probably a good idea to do it for reptiles too. They have their own set of problems and we need to get to the bottom of those and make sure we're keeping them healthy in the same ways.
Well, yeah, we spent like 40 minutes of this end up like tying them back to just, oh, they're actually kind of like dogs like this. They're kind of like cats. Actually,
Right.
that's a cat thing. Oh, wait, that's a cat thing. Oh, that's a cat thing. So, yeah, they're super different and like it's important to understand like, yeah, a corn snake is not a ball python and a leopard gecko is not a bearded dragon, but good medicine is still good medicine, regardless of if you're working on a cat, a cow, or a snake. So I think that's really the take home.
I was going to say, we're going to wrap it up right there because that is exactly what the take home is. Good medicine is good medicine. So Dana, thank you again for joining me. I can't wait for the next time. I have this one spurred so many questions, so I can't wait to ask them on the next one.
Good. Yeah. I can't wait to chat again. I hope everyone has a great day.
Dana, thank you again for coming on the show. I am really excited for where our next conversation takes us because these conversations, whether they're about reptiles or snakes or pigs or bunnies or whatever we decide to talk about, they're really educational, and I feel like I take away some good practical points every time we talk. So thank you for that. Thank you to everyone who tuned in for this one. I hope you enjoyed it and learned a lot as well. If you did enjoy this episode, please leave us a 5-star review wherever you get your podcast. It really helps more veterinary professionals like you discover our show and VetFolio and all of the other content we try to put out there. You can also explore more episodes by checking out the VetFolio website or listen wherever you get your podcasts. And we are always eager to hear your thoughts and ideas for future episodes. So if there's something that you haven't heard that you want us to talk about, absolutely reach out to me at dvm@vetfolio.com. You can connect with me on Facebook at Dr. Cassie DVM or follow me on Instagram at dr.cassie, C-A-S-S-I, no E, .dvm. And remember, if one animal is better off because of you today, it's a great day.